Hi, I'm Dr. Suresh Ramalingam, thoracic oncologist at Emory University and the Winship Cancer Institute in Atlanta. The good news is patients with lung cancer are living longer and living better. We now can provide hope to patients that long-term survival is possible even with stage 4 non-small cell lung cancer. Why do I say that? Well, for patients who have targetable driver mutations like EGFR and ALK, now the median survival is measured in years, not in months. 10 years ago, we were thinking of stage 4 disease as a condition where the median survival was 10 to 12 months. Now that's not the case. Now, for patients who do not have a targetable driver mutation, immunotherapy has made a major difference in the treatment. For patients whose PD-L1 expression level is greater than 50%, we now use immunotherapy as the go-to option. And for these patients, the 5-year survival rate is now 32%. And this brings up the question, if a patient has made it to 5 years without having any further progression of his or her cancer, does that constitute a cure? Our hope is it is a cure, but we still need to follow up these patients for a longer period of time before we can make that conclusion. Having said that, we're all seeing a number of long-term survivors in our clinics, thanks to targeted therapy, thanks to immunotherapy. I can mention the situation of one of my patients. He is now 79 years old. When he was diagnosed with stage 4 lung cancer, this was about 3.5 years ago. He was fully functional, healthy, no other medical problems. He had smoked long time back and had quit smoking for over 25 years. Patient had noticed that he developed headache on and off. And once this started getting severe, he went to the emergency room for care. And he was found to have 2 lesions in the brain that looked like metastases. So he had further workup. He was found to have a mass in his right lung. He also had involvement of some mediastinal lymph nodes or lymph nodes in the middle of his chest. Biopsy was done, and it unfortunately confirmed the diagnosis of stage 4 lung cancer. The patient presented to us at that point. We did very thorough molecular testing, and we could not find a driver mutation. Fortunately, we found that his PD-L1 expression level was over 50%. And at that point, we discussed him in our multidisciplinary tumor board. Our radiation oncology team and our neurosurgeons were part of the conversation. And we had an exciting trial where patients were given stereotactic radiosurgery to the brain lesions and then were given immunotherapy if they had high PD-L1 expression. So this trial was offered to the patient and he volunteered to participate. So he had stereotactic radiosurgery to those 2 brain lesions, and then we started him on pembrolizumab. He did really well, tolerated the treatment well, and his first scan after 2 months showed complete regression of the mediastinal nodes and a substantial reduction in size of his lung mass. So we were very excited about this. We continued him on immunotherapy, and 6 months later, he did not have, we could no longer see the lesion in his right lung. He had a complete response. And the other important piece of information is when we followed his brain with imaging studies, he did not have any further progression of the disease. He had the post-treatment radiation-related scarring in the brain. Now, a year later, we ran into some trouble because his liver enzyme started going up. And we looked up for other possible causes of the liver enzyme elevation, and there was no other attributable risk factor. So we deemed that it was the immunotherapy that was causing his liver enzyme elevation, and therefore we had to hold the immunotherapy. The liver enzyme came back to normal within a few weeks of stopping the immunotherapy. And the elevation in the first place was high enough that we did not feel comfortable exposing him again to immunotherapy. So we said, let's watch you closely with imaging studies. Now, it's been almost 2.5 years since we've been watching him without any treatment, and he has not had any progression. He continues to do well. He has no symptoms. He's able to experience a quality of life that is similar to somebody without any cancer. Now, we don't say that he's totally out of the woods. We continue to watch him with scans every 3 to 6 months. But this situation illustrates the power of immunotherapy to us. Long-term outcomes are possible in advanced stage lung cancer with immunotherapy and with targeted therapy. Of course, when I walk into every patient's room, it is my hope that every patient sitting in front of me is going to make it and become that long-term survivor. We know that we're not there yet, but we're making good progress. And for that, we're grateful to our patient community because they have volunteered to support these clinical trials. They have volunteered to participate in efforts to increase the level of education among the patient community that is allowing us to make sure every patient is getting, or allowing us to proceed with the notion that every patient should get molecular testing, every patient should get appropriate therapy based on its biomarker status.